Epidural during labor. So many women nowadays utilize the epidural because it's an amazing pain relief technique, especially for long labors or labors that have been very long and you're very exhausted. Obviously, other reasons as well. They're great for anybody who may be adverse to the pain of having a baby. I mean, who's not adverse to that? But or doesn't feel like that, like the preparation that kind of goes into having a non-medicated labor is something that they really want to do. Whatever your reason is for having an epidural, it's a great choice. Discuss it with your doctor and go from there. I want to talk a little bit about risks and benefits of the epidural, just to be prepared for the things that could potentially happen. Obviously, one of the benefits of having the epidural is that your contractions are much less intense. It doesn't necessarily take your contractions away. At times, the epidural can completely numb you and you won't feel the contractions at all, but at other times, you can still kind of feel that something's happening with your body, but the intense pain of the contractions is much, much less. So that's obviously a huge benefit. It also can help you get the rest that you need. Like I had said before, labor can be very long and exhausting, and having an epidural and having a little bit of respite from that pressure can allow you to get the rest that you need to potentially keep you away from having a cesarean birth or an emergency C-section for your baby. So, that being said, the risks of the epidural sometimes include the epidural not working at all. There is a small percentage of women who simply their spinal anatomy does not allow for the epidural to work. And that can be frustrating when you've planned ahead for the epidural and it doesn't work. It can also work really well on one side and not great on the other side, which again can be frustrating because you're feeling the whole labor on this side and you're not feeling anything on this side. So any comfort measures or anything that you've kind of planned ahead for focus can kind of go out the window, which can be a little frustrating. So having a good support team during that time is critical because it can be very difficult on you and on your emotions. Another thing is a spinal headache. So after all is said and done, and they've taken the epidural out, a little leak in the spinal fluid can happen, and that can give you a spinal headache, which can be a very severe headache. What they'll do is they'll go in and put in a blood patch and patch that up for you. But it's something to be aware of, that if you do feel a headache coming on, or you have been having an extreme headache after your epidural, that could be what you need to talk to your doctor about. Some other obviously more severe and very, very small percentage of risks might include not getting the feeling back in your legs, or something happening with your spine. Obviously, your spine is a very, very sensitive area. So thankfully, anesthesiologists today do tons of epidurals. And like I said, chances are very low that something like that would happen, but it's something to be aware of when making that choice. Again, the epidural can be an amazing tool to use, especially if you're adverse to the pains of childbirth and just kind of want to experience it in a different way. Everybody has their own opinions of how they want to experience labor, and the epidural is just one more tool that can help you get to that point.